And that's your entertainment news for this Friday morning on 102.7 WMOM.
All right, thanks, Al, for that. It's 8:26 now on 102.7 Bomb FM, and welcome to it. Speaking of the last story right there, the heart disease, well, we're going to be talking about heart disease and stroke awareness over the next few minutes with the two individuals that have joined us in the studio. Kevin Franklin, Manager of Emergency Services at Corewell Health. Good morning, Kevin.
Morning, Chris. Thanks for having us on.
Absolutely. Thanks for being here this morning. Also in the studio with us is a Dr. Zachary Hamersma. Dr. Hamersma is an emergency services physician, emergency care specialist at Corewell Health. Welcome to the studio as well.
Thank you.
Absolutely. Let's talk about this topic. And for the next few minutes, from the listener's standpoint, things that hopefully they'll be able to pull from this is symptoms. We talk about that. We're talking about care and what happens when you get to Corewell Health or any other emergency room. We're going to be talking about a new certification that Corewell Health has received, which is exciting to hear that, and what that means for us here in West Michigan. Let's start, Dr. Hamersma, with strokes itself. We always hear that time is important, and that's where, Kevin, we're going to be talking about the Be Fast idea and what to do there. But what is a stroke in the sense? Is it just the body shutting down? Is it just the heart shutting down? Can you help us with that?
Yeah, of course. Fantastic question. And kind of stroke, we always think about this based on symptoms from a community perspective, but medically we take it a little bit different. We think about what's going on in the body, how is the body changing, because this helps us how we treat it. I'm going to share a little bit of that with you just because then it helps, hey, what are we looking for overall?
Yeah.
So the idea with this is the brain is not getting blood supply. And when the brain's not getting blood supply, certain functions shut down. This is tricky, and it can actually be almost anything, quite honestly, because if you block a blood vessel to the brain, it all of a sudden starts to starve for oxygen, and actually you can start to have certain cells die. When this happens, right, we then get the symptoms because we don't always get specifically pain in the brain with a stroke or headache pain. On the flip side, stroke can happen too if there's bleeding into the brain as well. Both of these fall into that stroke category. And that bleeding itself can cause very similar symptoms, and that oftentimes actually has pain with it too. So this kind of helps us gear how we treat this overall. But I think can be helpful in starting to think, hey, what are we looking for to identify these? Which, of course, Kevin will touch on a little bit more in a little bit.
And when you're talking about bleeding in the brain, and you brought up a very good point about that, you might not be feeling that as a symptom. It's not hey, my head hurts or anything like that. Can something trigger that? Can stress? What is those trigger points that might lead to that bleeding, if you don't mind?
Yeah, of course. So sometimes this can be, quite honestly, our genetics and being unlucky. It can be hypertension related. Sometimes it could be related to head injury. All of these, kind of a huge, big host of things that could lead to this overall. But most often our strokes are going to kind of just, for the lack of better words, come out of the blue.
Okay. And strokes and again, part of the educating of me and others out there, but strokes and heart attacks, is there any sort of relationship to that?
Yeah, there's actually a huge relationship. We're starting to see more and more that the things that cause these blockages in blood vessels are the same risk factors. They're the same food choices. They can be related to, poor health, obesity. All of these things are very closely related. And quite honestly, if a blood vessel is blocked in the heart, we call that a heart attack. If it's blocked in the brain, we call that a stroke. Okay. And these are really very similar things.
What about, and I throw this out there, can it truly happen to anybody out there, or is it genetic? Do you have those conversations with your parents and grandparents and so on and so forth, or are we all susceptible to this?
Quite honestly, this is one of the leading causes of disability and even death in everybody, and we're all susceptible. Okay. There are certain things that we can trace back for individuals, but the grand majority of people, this is really common. That's why we're talking to you about this today, and we're all at risk.
And Kevin, let's dive into part of that is having that conversation. And it's the Be Fast conversation. And I know we've talked a little bit about this on Mom FM before, but this is a true acronym that we want people to remember because, as Dr. Hamersma had mentioned, it can happen to anyone, and when it does, seconds count with like any medical emergency, but it's critical if there's a stroke happening, right?
Yeah, it absolutely is. And that's why the BFAST symptoms, and I'll just go through these real shortly here. But one of them, the very first part of the BFAST is balance. And so most of us, when we wake up in the morning and we get out of bed and we go for our cup of coffee, we're not stumbling around as we move through the house, or when we get out of the shower, we're not falling down unexpectedly. And that's one of those first signs that something's not right. You're not quite sure what it is, but your balance is off, or you see your loved one's balance is off.
Can we dive, and I want to dive into a little bit specifically as we go throughout this, if you don't mind me asking a question or two.
Absolutely.
When somebody wakes up and they characterize that as just, my body's starting to start to function and get ready and so on and so forth, or how different is it from just, maybe swaying one way or the other for a moment there? Is it truly seriously noticeable, I guess, if that makes sense?
Yeah, no, that's a great question because, as we age a little bit, our blood pressures change when we first get up and things. So, I'm 54, so when I first get out of bed, sometimes you feel a couple seconds of, whew,
yeah,
boy,
exactly.
Got up too quick. Not a big deal. It's just when that lasts for 30 seconds, the next couple minutes, and you realize that, no, my body hasn't auto-regulated back to what it used to, and that's when you really have to raise your awareness. Something's not right. This isn't how I went to bed. It's not how I normally feel in the mornings. And that's that first sign when your balance is off. Doesn't always there, not for everybody, depends on where the stroke is at, but it is one of those key factors that we're looking for.
Okay, and then the eyes, the B, and then the E is the eyes, right?
Yeah, yep. So the eyes, it's really about visual. So if you wake up in the morning and suddenly your vision has changed, for a lot of our stroke patients, they're not able to see in their normal field of view. So most of us, we can kind of, that peripheral vision that we talk about, you can kind of see off to your side and, see when that baseball's coming at you when you're at the game. But when you lose that, that's another significant sign that there's something wrong up there in the brain, whether it's a clot or a bleed or something going on. And so we want patients to pay attention to that because your changes in vision, as we age, our change in vision happens progressively, slowly. I started wearing glasses when I was 45, so it doesn't happen quickly. Suddenly you lose your ability to see to the right. That isn't normal. One of the other signs with vision is your inability to move your eyes to the right. Again, you'll recognize that that's not a normal thing that happens to us, and we want you to immediately call for help when that happens. That's the E of BFAST.
And we're going to take the FAST of this in a moment, but for our listeners, if you're just joining us, we're talking with Zachary Hamersma and Kevin Franklin from Corewell Health. Dr. Hamersma, there's a question that came up as Kevin was mentioning that based on that bleeding in the brain can affect the eyeballs in one area or the balance in another area. Is that like when that bleeding happens that is that's going to change a sensory of your body in the sense?
Yeah, so what's happening here is we're either having a certain part of the brain that responds to our balance or our eyes and our vision, and that part of the brain then would not be getting the blood supply that it would need, or there's bleeding around that area of the brain, and this then causes it to almost shut down. And when this happens, we lose that function. We lose that ability to kind of see out of certain parts of our vision, or we lose that ability to kind of know where we are in space, and these are very kind of complex mechanisms for the brain that are somewhat kind of shutting down or going dormant for a period of time.
And our bodies are always trying to heal themselves. So is our body at that moment when something is suffocated from getting that blood, do we then see other symptoms that come into play that might make up for those efforts. Does that make sense a little bit?
Yeah, we do actually a little bit. Sometimes we can see blood pressure spike where the brain is trying to get more blood supply for itself. That's kind of the biggest compensation that we see. But it's tricky, and I think that the brain, while we wish there was more it could do to fix itself, unfortunately kind of goes unchecked or without then medical intervention. Oftentimes these areas ultimately do, the cells start to die. The tissue dies.
Okay. And we're going to be talking about the care when that patient enters the hospital here in a moment. But Kevin, let's take the focus now on the FAST part of Be Fast. That F stands for the face, and we talk about this, at least my first perception, tell me if I'm wrong, is when somebody has a stroke or is going through a stroke, it's the droopy face side, or, part of their face doesn't react like the other part of their face. Is that the F in when we look at the face side of things?
Yeah, exactly, Chris. So most strokes happen just on one side or the other of the brain, and so when that happens, that other side of the brain will have what we call a facial droop. People won't be able to smile. One of the tests that we do is we just ask people to smile and show me your teeth, because if someone can do that, then it really helps us differentiate whether there's any facial droop. And that's one of the challenges, because people wake up in the morning, I'm just kind of tired, or in the middle of the afternoon, I just need a nap. And even when you're looking at somebody else, you're like, gosh, it just looks like your face is kind of drooping a little bit, but they don't take on that. And we'll talk a little bit later about, the emergent of recognizing these and moving on. But yeah, for facial droop, that's what we're really looking at. Can someone smile and show you their teeth, and everything should be pretty equilateral across their face.
And just to clarify, this isn't meaning that they've had a stroke. This is the symptoms leading up to a stroke, or could they have had a stroke already? Clarify that for us, if you don't mind.
Yeah, no problem. So it actually is both. So when you're actively having a stroke, losing that blood supply to those that part of the brain that controls the muscles for your face, that's why you can have that facial droop. After you've had a stroke, let's say 2-3 weeks later, you'll still have some of that facial droop. Now, over time, sometimes we have additional blood flow that comes back to parts of the brain, and the brain's able to kind of recalibrate, and you're able to get some of that function back. Some people do, some people don't. Okay. And that's why that treating stroke is such an emergency, because we don't want you to get to the point to where we're depending on your body to rebuild itself.
We're talking about stroke awareness this morning, and we've covered the BE as balance and eyes in the Be Fast. Face is the F. Arms comes next, and similar idea with the face. If there's some drooping or functionality that is not normal in either arm, right?
Exactly, yeah. And that's it's both arms and legs, but we see it more prominently in arms, that people will just suddenly start losing function of an arm that or a leg that they hadn't. And usually, again, it's on the opposite side of their body than what the stroke is. But that's also what Dr. Hamersma and the team use to help differentiate where that's at, even before they get a CT. And so, if suddenly you're just your leg is really numb, it feels heavy, you're not able to move it like you normally would, and you notice that your arm is doing the same thing on the same side, those are significant signs that you may well be having a stroke and need to seek care right away, because time is of the essence as we talk about this today. And literally with the brain, minutes make a big difference.
Absolutely. And as Dr. Hamersma mentioned, that bleeding in the brain, that blood needs to go somewhere, and that pressure is going to continue. And I would assume the symptoms and the time starts to reduce in regards to when you need to be in the hospital and be taken care of. Speech, that's the next thing that is part of the FAST, F-A-S-T. The speech, and we've seen that in movies and television shows and such, that if somebody's talking and then they just either they can't make those words out, or they're not even making sense at all in their conversation, right?
Yep, exactly. And so again, it's depending on what part of the brain is being affected. There's parts of our brain that affect how well we can speak. There's parts of our brain that are called receptors, how well we can hear and comprehend what's being said. And there's a part of our brain that forms speech, so forms our thoughts. The result is that patients that have difficulty getting words out or understanding what you're saying to them or being able to enunciate what is going on are significant signs that there's a change. Now, normally we see it as kind of a slurring of their speech, and that's that first part of it that we see for many of our folks. But for some stroke patients, it's simply that deer in the headlight look. I mean, they look at you, you can tell that they're inside, but they cannot get any words out. They just can't form the words. And that's another significant sign when we talk about speech related to strokes.
And we're making our way through the B FAST, which is balance, eyes, face, arms, speech, and then a terrible headache. And as mentioned just a moment ago, is that because, well, obviously because there's normal stuff not happening in your brain, right? There's blood there's blood, you're bleeding in there, but also that pressure that happens too, right?
Yeah, so the terrible headache actually is a really significant sign for us related specifically to bleeding patients that are having a hemorrhagic stroke, because normally we don't have head pain like you do for an arm pain or chest pain for your heart. And so when patients have this excruciating headache, worst of their kind, oftentimes in the back of their head, that's a significant sign to the medical team, Dr. Hamersma and the other nurses, because we know that for most patients, that is very uncommon, even those patients that have a history of headaches. And oftentimes when they're doing their initial workup, their blood pressure will be significantly elevated during that time too. As Dr. Hamersma talked about, the body is trying to increase blood flow to that area because it's not getting enough blood, but that's also causing more bleeding. So it really is one of those symptoms and signs that we look for, terrible headache, worst of its kind. We want people to get checked out right away for that, because if you wait and you end up going to sleep, some of those patients never truly wake up because that bleeding continues until other symptoms show up that then cause folks to call 911.
If you're just joining us, we're talking with Kevin Franklin, Manager of Emergency Services at Corewell Health, and Zachary Hamersma, Emergency Services Specialist and Physician there at Corewell Health. Dr. Hamersma, we talk about, which would be the next thing, is if when you're seeing those symptoms and signs, to be able to call 911, to react, to get to the hospital, to get that person to the hospital. And I know the answer already is as fast as possible, but what is that time frame when those symptoms start that you're able to really help that patient before it becomes severe or even irreversible?
Yeah, so we have kind of a couple different things here, and really the most important one is treatment in the first 3 hours can provide the best outcomes for anyone. Okay. Now, the key with that is we have to provide the treatment in the hospital too in that time frame. Mm-hmm. This makes it somewhat challenging, right, if people are showing up right at that 3-hour time point. It's not quite, because we have work that we have to do there. So sooner is better. Mm-hmm. And with that, providing kind of using resources like an ambulance can be helpful, because they actually are doing a lot of the screening and trained to do it for us. Okay. And they alert us in the hospital and get a lot of this stuff going that otherwise takes time for us. So that can actually be a huge benefit for us as well.
And we're going to be talking about that when they reach the hospital. Here, if you're just joining us, it's stroke awareness, and I think it's so important for us to all be aware of this, because Dr. Hamersma, we could be walking in a grocery store and going down that aisle, and somebody's coming towards us, and they have those symptoms, and the more that we can identify them, the more we can react and help that person, right?
Yeah. I think it's very possible. If we're seeing these things in the community and seeing other people and reacting to these symptoms, right, we can be asking them and asking for questions. Not everybody's around their family at all points in time and could be having these symptoms. And they may be struggling with, how do I respond to this? How do I deal with this? Or maybe even those parts of their brain aren't really working that well based on their stroke. So they may need our help in the community. That's why family is so important as well. because they're going to be there to help identify this, help call the ambulance, help get people where they need to be, which is ultimately the hospital. Because sometimes patients can't do all this legwork on their own. Other times, based on certain different types of strokes, it's possible they may be able to make these phone calls too. So it's really important to have community support, to have family support, to be able to treat everyone.
And that's a big question that I have, Kevin, is when we're going through those symptoms and those signs, how much do we identify that we're going through those signs and can react to help ourselves?
Yeah, that's a great question, Chris, because oftentimes, we'll decrease the significance of a sign that we have, especially when we're looking at ourselves and I just feel a little bit off, or my balance is off, or gosh, my side of my face feels numb. And that's what we have to really be aware of with ourselves and cognizant, because if we wait too long, we'll end up with so many symptoms and signs that we can't then implement our own care. Something as simple as, maybe I've lost the ability to talk. I can't quite figure out what's going on, but I can pick up the phone and I can dial 911. And maybe I can't even speak, but that 911 operator is going to latch onto that and realize something's not right. This person called 911, they're not hanging up, and they're going to go ahead and send, at the minimum, they'll send police out and probably rescue at the same time, and that way we'll be able to get that rolling. The other thing is, a lot of times, unfortunately, I'm a Michigan State fan. I was watching the game like everybody else, and you might be having symptoms in the middle of the game, and it's like, no, you have to step away and address that, because when you wait an hour, hour and a half till the end of the game, just like Dr. Hamersma was talking about, if I used up an hour and a half of that 3-hour window and then it takes 20 minutes to get down to the hospital, I'm really putting the pressure on everything working well in order to still provide me treatment in that window. So earlier the better always.
And from a statistic standpoint, you mentioned this before we went on the air today, is that you see a majority of the patients, or a lot of patients, come in and they're outside of that window, right? Because they're kind of blowing it off. It's like, it's just something. I'll take some pain meds, or I'll sleep it off a little bit. But they're outside of that window majority of the time.
Yeah, that's one of the fortunate but unfortunate things we found. As we prepared for our stroke certification, we had to do a lot of digging into charts and monitoring how things were going. And what we found is almost 80% of our patients show up to the emergency room too late outside of that window. So that was a big push for us, and that this year we're really pushing stroke awareness to help people recognize those symptoms early, get into the hospital, call a family member, get someone moving on it so that you can get within that window. And that way, if Dr. Hamersma and the team can address it and it is a stroke, then we can do something about it most of the time.
Absolutely. If you're just joining us, we're talking with Kevin Franklin, registered nurse manager of emergency services at Corewell Health, Ludington Hospital, along with Dr. Zachary Hamersma, the emergency services physician and emergency care specialist. And let's talk about, and you mentioned the certification. Let's jump right into that, because we want the listeners and viewers to know that our hospital here in Ludington is continuing to advance its priority on patients, on making sure that everybody is taken care of when they come in and through the doors there. And part of the Joint Commission recently gave a certification to the Ludington Hospital. And Dr. Hamersma, that must mean, and I want you to dive into the certification, but just off the surface, when you're recognized as focusing on this area and helping to save lives, I would assume you and the team there think that that's a pretty big deal, right?
Yeah, it's actually a huge deal. I mean, this certification is one of the most prestigious in all of the United States for stroke awareness, for stroke accreditation. And what they've done is actually went through a deep dive of our institution and said, how are you handling stroke? What are you doing? What's your process? How are your patients doing? And they ultimately say, yeah, you meet with our qualifications or you don't. Thankfully for them, they went through our institution. They offered us some recommendations, but they also told us, you're doing a great job. We like what we're seeing. We're happy to grant you this accreditation. And then, ultimately, we're saying that you are qualified to care and treat stroke patients to the highest standard in the United States, which is fantastic. I mean, this is a huge thing for us. A lot of work has gone into this, a lot of process improvement, a lot of staff education, and this is a great honor, quite honestly.
And it's pretty nice because you're one of 5 Corewell Health hospitals here in West Michigan, with the goal of having all the Corewell Health centers and hospitals be certified. But it's kind of nice to be one of the first to lead the way, right?
It definitely is. And it's, for us, right, to be one of the first is more challenging, but also shows that we're doing a good job at this. And it's really great overall for Corewell Health to be one of these primary stroke centers. And it's looking by the end of the year, all of these centers should be certified as well.
Good to hear that. And for the listeners and viewers, this doesn't mean just the in-person care. It also means part of the telehealth that is a big part of our lives this day and age, right?
Yeah, exactly. So we have, at Ludington Hospital, a lot of great resources. But on the same token, too, we need extra things. And there's very specialized stroke neurologists that deal with these diseases specifically. These physicians work in our kind of central hospital, which is Corewell Health Medical Center. I apologize for the name change that I'm still getting used to.
We're all getting used to it. It's all right.
And this is the Butterworth Hospital in Grand Rapids. Now, they work there because of the resources for the intervention capabilities. And what I mean by that is they can actually go in and pull clots out. But these physicians also, they, in a telemedicine-based process, review patients in Ludington. They see everybody that's there. They provide their recommendations. They're one quick phone call away for me and always available. So these are fantastic resources for a hospital of our size where we have this available for us. Otherwise, if we didn't have these robust systems, we unfortunately wouldn't have the volumes to be able to have a physician like this. But we've come up with this telemedicine way where we can provide the exact same quality of care from a distance, which is fantastic.
And many of us on the outside, we assume that our physicians are always trying to learn new techniques to be able to, I would assume you're always, there's always something new, but as a physician, can you reassure us that you're always learning something new, right?
Of course, yeah. That's quite honestly a requirement for our licensing, that we constantly have continuing education. We're involved in tons of programs for this because that's the nature of it. We have to keep learning. We have to keep adapting because medicine always changes.
Let's talk about, as we wrap up this morning, and I appreciate both of you taking the extended time with us this morning, and I hope that as listeners and viewers taking in this segment, do truly learn or pull something away from this in many facets of it. We're talking with Dr. Zachary Hamersma, emergency services physician, emergency care specialist, and Kevin Franklin, manager of emergency services at Corewell Health. Before we wrap up, I think it's important for the viewer and the listener to know that, we talked about the signs and the symptoms and the Be Fast acronym. And we talked about, obviously being certified, the certification that you've earned to ensure that there is more communication, there is more resources available. But before we wrap up, what happens, Kevin, when we reach the hospital? From that standpoint, what is stroke care like through those emergency doors?
Yeah, that's a great question, Chris, because it is really rapid. So one of the things that we did as part of becoming a primary stroke center was we established what we call a stroke hotspot. And what this is it's a specific part of the emergency room. We actually converted our triage bay into it to where all stroke patients, whether they come in by EMS or they come through our front doors, are first evaluated in that stroke hotspot. We have a special alert notification system in that room that allows us with one button to go ahead and activate pharmacy, laboratory, radiology, the ER providers, the nurses, that a stroke patient is in that room. And that allows everyone to come together really quickly. So unfortunately for our patients, you're going to feel overwhelmed by having 5 or 6 people at your bedside within the first couple minutes. But the reason for that is your nurses are going to immediately do what we call the NIH stroke scale, which is an evaluation of how significant your stroke is. At the same time, another nurse is going to be establishing an intravenous line for you. The laboratory is going to be collecting some lab values. Radiology is going to be preparing our CT scan, and the provider is going to be talking with the patient and assessing how significant their stroke is. Our goal is within that first 5, most 10 minutes, we're going to have all of that completed and you're going to be on your way to CT scan. Once the CT scan is done, then you're going to be brought back out into the emergency room. And at that time, you're going to be placed in a regular emergency department bed, depending on, just whether you need other treatment modalities or not. The physician, Dr. Hamersma, and his colleagues already at that point will have been able to see the scan so that quickly on our new CT scanner. They also at the same time are being sent down to Butterworth to be evaluated by the radiologist at the same time. Our goal is within 30 minutes from when you arrive, if you are having a stroke, that we're giving you a medication called tenecteplase that will go ahead and break that up. That's the national goal is 30 minutes. Now, very few hospitals can reach it. I'm very happy and proud to say that Dr. Hamersma and his team, we have had 2 occurrences in the last several months where we were able to get tenecteplase into a patient within 35 and 36 minutes respectively. So for a regional hospital our size and a community like ours, that is just incredible work. But that's what patients can expect. There's a lot that goes on. They're not even going to change you out of your clothes until you get that CT scan. Our goal is to really get that scan done so that Dr. Hamersma and his colleagues can determine if it's an acute stroke and what do we need to do in the next treatments.
And it's important as we wrap up this morning, Dr. Hamersma, to know if it's the 2 types of strokes. And we highlighted this early on, but and I can't even pronounce them, so you're going to have to help me with these 2. But the names, but also why is it important for you to know which one it is?
Yeah, of course. So the 2 types of strokes, one is called hemorrhagic, the fancy term for it, and that's bleeding within the brain.
Okay.
The other type of stroke is ischemic, or this is a blocked blood vessel and not enough blood supply to the brain.
Oh, okay.
We treat these very, very differently. Then the medication that treats the ischemic, or the blocked blood vessel stroke, that medication is actually dangerous to be given to patients that have bleeding in their brain.
Okay.
So we need to come up with answers to this quite quickly because that medication can be effective in reversing symptoms for some patients, but ultimately it can be unsafe for certain people as well. So this is very challenging for us because we need to get a lot done quickly. We need a lot of answers to know the best treatment option, and time for everyone matters.
Very important. I've learned a lot today, and I know we just kind of scratched the surface on this, but the resources are available. Those questions and being able to have that conversation is important. I know Corewell Health's website, there's a lot of information and resources there. But Kevin, what is your one recommendation in regards to stroke awareness? I would assume it's just part of having that conversation. But more importantly, it's probably knowing those signs too, right?
Exactly. Yeah, really being comfortable with BFAST specifically, but anything that seems off, we want patients to preferentially call 911 because, like Dr. Hamersma said, they're going to be able to institute some of these things even before they arrive at the hospital. But getting to the hospital as soon as possible. And that's one of the things that, 24 hours a day, 365 days a year, we have our staff on duty ready to take care of those patients. And if it's not a stroke, within 15 minutes, 20 minutes, we're going to know that, and we'll continue treating the patient for whatever they're in there for. But our hope this year, really focused 2023, is trying to improve that percentage of patients that arrive to the hospital within that window so that the team can implement some therapies and have better outcomes.
Well, it's crucially important, that time factor, and we appreciate you going over that. So for the viewers and listeners, remember that Be Fast, balance, eyes, face, arms, speech, and that terrible headache is going to be those part of those stroke signs or symptoms there. And if you missed any of this segment, you can watch it in its entirety on our Facebook page and or YouTube channel. But please do that and have that conversation. And as Dr. Hamersma mentioned, strokes can happen to anybody out there, so it's not necessarily age related. It can be something that happens to the younger side of us, right?
Yeah, it can. This can be anyone. While it's more common when we're older, it certainly can be any individual. So very important to think about this for really any age group, quite honestly. All
right. Well, we appreciate you coming in. Dr. Zachary Hamersma, emergency services physician and emergency care specialist, as well as Kevin Franklin, they're the manager of emergency services at Corewell Health. Thank you guys for coming in today. We appreciate it.
Yeah, thanks for having us.
It's 9:02 here on 102.7 Mom FM. Let's kick off the 9 o'clock hour. News and weather comes your way in seconds on 102.7. It's Mom FM.
Thanks for making us number one.